Hi, my name is Sakina Patanwala and I will be presenting the milestone for our final project. For this project, we are working with Providence Healthcare under the supervision of their representatives. In this video, I'm going to introduce our project titled Anomaly Detection and Surveillance System for Diagnosis in ICU Patients. In this milestone presentation, we will go through the project motivation, the objectives behind the motivation, the challenges faced for achieving those objectives, action plan, progress report, and future work. Big data can revolutionize healthcare and has the potential to bring social benefits to the public, such as delivering better patient treatment, improving drug efficiency, and hospital operations. In this project, for our first objective, we aim to predict the mortality rate and possible duration of a patient's stay for effective hospital operations to provide better services to patients and also help caregivers. Antibiotic resistance imposes a heavy burden on healthcare. Clinicians rely on prior experience and static clinical guidelines to prescribe antibiotics without accounting for patient-specific attributes. Hence, for objective number 2, we plan to predict the efficiency of various antibiotics against distinctive pathogens. Lastly, vital sign is one of the most critical data to monitor the current status of a patient. With anomaly detection, we will know the patient's recent vital signs that are anomalous and send a warning to the hospital staff if there is an emergency. However, there are a few challenges in achieving these objectives. The biggest of all is being unable to predict and implement effectiveness and resistance of antibiotics on certain pathogens over the years, as the years in the date stamp are not true to real time. Care paths for patients vary significantly from individual to individual, and we are being restricted on suggesting them to new admitted patients as they depend on a lot of other patient demographics which the dataset is missing. Extracting useful features manually or through algorithms has been challenging as it is a massive dataset with over 40 gigabytes of data, 534 features which are present in 40 different tables. Our current progress is that we have finished studying the healthcare domain knowledge and explored the tables and features in the dataset. We have joined the necessary tables and performed EDA. Currently, we are in the process of feature engineering. In the future, we plan to choose the most fitting machine learning model for each task based on the size of the data, feature space, accuracy, and interpretability of the output model. Model building will be followed by metric evaluation, and for product containerization, we plan to use Docker to deploy our machine learning models, followed by data visualization. Here is the proposed architecture we have designed to implement a containerized machine learning model as our result. Please pause to have a better look. MIMIC3 is a publicly available database consisting of de-identified intensive care unit, that is, ICU patient data, and we can see the creation of the dataset in the flowchart on the right. For producing these schemas, we use pandas to combine different tables into one and cleaned the data table for extracting useful features. This is the data schema we have produced for Objective 2. Here is a graph achieved from our objectives that demonstrates the distribution. We used it to select the top 20 frequent diagnoses in the MIMIC dataset. Here is a timeline of our project in relation with the project architecture we saw earlier. The timeline helps us keep tabs on important project deadlines and meetings with Providence Healthcare representatives. As we can see from the timeline chart, we are on schedule. We use a Kanban board to keep detailed tabs for tasks pertaining to each objective which are needed to be achieved, and it makes it easier to communicate and manage time as we assign tasks to each member in particular. We also separate tasks which are finished, in progress, and need to be done from each other. One major risk for our project is the usefulness of the model in the real world. Therefore, we have to consult with healthcare professionals and conduct feature engineering cautiously. The dataset we are working with is about 40 gigabytes, so it might not be possible to process all of it. Therefore, we have planned to extract smaller subsets to work with. Thank you for watching.